Studying for MRCS Part A? Bone diseases got you puzzled? Let's simplify it. This video will give a key summary of Paget's disease, osteoporosis, osteomalacia, secondary bone tumors, avascular necrosis, and osteogenesis imperfecta. First up, Paget's disease. It starts with bone resorption, then chaotic deposition, leading to dense but brittle bones. Commonly, it hits the spine, skull, pelvis, and femur. Watch for a rise in ALP on labs and thick sclerotic bone on X-ray. Treatment for this is bisphosphonates. Next, osteoporosis, which is a disease of excessive bone resorption. The patient demographic is older. Age or steroid use ups the risk. Biochemically, there is a normal ALP and calcium, but investigating with a DEXA scan will show the quality of the bone. A T-score of -1 to -2.5 is diagnostic. Treatment includes calcium, vitamin D, and bisphosphonates. Osteomalacia is a disease of the bone where there is low mineral content. In adults, it presents as bone pain and muscle tenderness. In children, it presents with knock knees and bow legs and is termed rickets. Causes include vitamin D deficiency, vitamin D resistance, liver disease. Look for low calcium, phosphate, and vitamin D, but high ALP. The treatment is calcium and vitamin D. Secondary bone tumors involve bone destruction from cancer metastases. Sclerotic or lytic lesions will depend on the nature of the primary tumor. When assessing the blood work, you can find high calcium and ALP. Treatment varies from radiotherapy to prophylactic fixation. The decision to offer fixation depends on the Mirel score. Avascular necrosis is cellular death of bone due to blood supply interruption, often affecting the femoral head. Be suspicious of AVN in patients with persistent pain despite fracture union. MRI is the go-to investigation in these cases. Lastly, osteogenesis imperfecta, a genetic condition making bones fragile. There are 4 types. The mildest is type 1 with blue sclera and can also be seen to have weak tendons, thin heart valves, and a dilated aortic root. The most lethal is type 2, often taking effect in utero. Short limbs are commonly seen. Unfortunately, these patients don't often survive past a few days of birth. Type 3 is severely progressive. It is often seen in combination with adenomyogenesis imperfecta. On X-ray, cartilage can be seen in the epiphysis and metaphysis. Last is type 4, which is moderately severe and similar to type 1. Patients with type 4 have white sclera and may present with fractures and bowed legs. Stay tuned for more MRCS Part A essentials.